All right, everybody. Well, let's go ahead and get started. We're here to talk about menopause. You know what, though? As we talked about this morning, a problem shared is a problem solved. We don't have to go through this alone. And it was really funny as Eric and I were talking earlier this morning, and he starts talking about periods like it's nothing. I'm like, I don't think I've ever talked to a man to have him comfortably talk about periods. I'm like, this is kind of cool. And to boot, he's a Marine. So he kind of addressed it this morning, but one of the things when I saw Eric on the schedule was, what is a dude doing talking at a women's conference about menopause? But then I got to know him. It's certainly not a mistake, so I'm very excited to have him here. Eric Rittmeyer is the Director of Business Development and a mental toughness coach at LifeMed Institute here in Baltimore, Maryland. He served in the United States Marine Corps and is an expert in the fields of mental toughness and emotional intelligence, two of my favorite things. He's also the author of a recently published book, The Menopausal Marine, Hot Flashes, Night Sweats, and Hormone Therapies, what every woman needs to know about menopause, and that's what he's going to share with us today. We are thrilled to have you here. Eric, take it away.
Thank you guys very much. I appreciate that. So, like Ann said, I think it is a little bit important for me to kind of just discuss a couple things before I get started. So I talked about it briefly early on. Everybody, when they hear Marine, when they hear mental toughness, emotional intelligence, when they hear guy, when they hear no medical training, someone who's very highly qualified to be here today. Thanks, Stacy. Yeah, last if anybody's going to register with Stacy. The gut instinct is, okay, why should I listen to this person? And I do get a lot of kickback. I do get a lot of constructive criticism from some ladies. I've already had some this morning. I appreciate all of it. Thank you. It's even better when it's in person as opposed to a death threat that comes via Facebook. But thank you for that. So the topic of menopause with me, guys, I just have to get this out there before I start to talk, right? I just want to explain to you what my objective is and why I'm doing this, why I've written this book on menopause. For me personally, working with LifeMed, involving myself in a wellness center, I had no training whatsoever, no medical training. I don't even have a college degree. Okay, I joke around. I went to the 14th grade. I went to Essex Community College, the 14th grade. I majored in underwater basket weaving, by the way. It's actually a wonderful thing. When I started working with LifeMed, I recognized very quickly that there was a major, major deficit for women's health. I had woman after woman after woman that would sit down in front of me, because I'm front-facing, I'm business development, I'm out in the community, I'm doing all the events, the TV, the radio, the podcast, the fun events, the goofy events. I'd sit down with them, and every woman would sit down in front of me and say the same exact thing. I have hot flashes, night sweats, brain fog, insomnia, hair thinning, weight gain, sexual vitality, vaginal atrophy, vaginal dryness, urinary tract infections, heart palpitations. That's pretty good, right? I took all week to prepare for this. I went to my GYN, they pulled my blood, the results came back and they told me I'm in range. They told me no chocolate chip cookies, don't drink wine, take some anxiety medication. Right? I can guarantee if any lady's been in that stage of perimenopause, menopause, and you went to the doctor, I can almost guarantee it's what they told you. So I started researching it. Right? I'm going online, I'm like, okay, what can I find about menopause? Because everything I was looking at appeared to be hormone imbalance related. Everywhere I went, I could find nothing on menopause. I found nothing. So I go to our medical director, who's a cardiologist. I go to our 10 nurse practitioners, our 2 physician assistants, our other MD, our nursing staff, and I'm asking them, can you all please direct me to wherever I can find information on menopause, because I can't find anything. And they all kind of laughed at me. And they're like, Eric, I can't tell you anywhere to go because there's nowhere that I can find either. And I'm like, are you serious? There's nowhere to, every woman I'm talking to, I'm on number 1,000 at that point. I'm on number 1,000, and every woman is telling me the same exact thing. There's no resource available, there's nothing. So I'm like, all right, you know what? I'm gonna write a book on it. So I just totally immersed myself. I was actually in the process of writing my second book. My first book's called The Emotional Marine. It's on critical thinking, objective reality, systematic desensitization, how to make quick connections with people, how to relate to people, self-awareness, self-regulation, motivation, empathy, social skill, all these things. I'm like, I'm going to start writing a book on menopause. So probably about 3 years ago, I started my research. A year and a half ago, I started writing the book. The result is The Menopausal Marine. And this is a book that is designed to educate women on what you're going through when you enter into menopause. What do hormone imbalances look like? Most importantly, what are your doctors not telling you? And it is dangerous. I get calls from GYNs at least once a week. Is this Eric? Yes, Eric. This is Dr. So-and-so. I'm like, hey, nice to meet you, sir. You're working with one of my patients. It sounds like I think you talked to Susan this past weekend about hormones. And I'm like, yeah, I did talk to Susan. I remember that conversation. Well, Eric, what's your medical training? I'm like, I don't have any. I can hardly read or write. Like, how can I help them? They're like, what do you know about hormones? I'm like, I know quite a bit about hormones. What do you know about hormones? 30 minutes later, they're thanking me. And initially, I was like, this is cool, right? Like, I'm not a smart person. I'm like, I'm educating GYNs. This is pretty cool. Now, I get angry. And when I hang up the phone, I tell them how upsetting it is to think that you have a doctor, a GYN, who specializes in all things women's health, that is either unable or unwilling to explain to them what they're going through. Women are deprived of quality of life. Women are deprived of long-term things that they should know about to protect their health. This whole book was about educating women on what's available to them. I am not here today to be a guy to tell a woman to just suck it up. I'm not here to say, oh, no big deal, hot flashes, night sweats, get a cup of water, get a battery-powered fan. I'm not here to say that. You thought that's what I was going to say. So I'd like to start off my presentations with just please getting that information there so all of you know what my goal is. My goal is to be a voice for you all. So when you start to go through these things, you're not deprived of the life that you deserve as you enter into a pretty significant portion of your life when you should be enjoying yourselves. So for me now, I take personal offense to it. So when people try to talk to me, I put my kids on emergency ringer. That's what happens when you put them on emergency ringer. Sorry about that. So when these doctors now call me, again, I get pretty upset about this. My whole goal for all of you is to just arm you with information that you need to make decisions about your health. Nobody, woman, man, young, old, no one should allow their doctors to make 100% of their healthcare decisions for them. Thank you. Regardless of what it is, and I'm not saying that you should be like, oh, you're a doctor, you don't know what the hell you're talking about, I'm not going to listen to you. I'm not saying that. What I'm saying is maybe 90% doctor, 10% you, maybe 80, maybe 20, whatever it is. This is about educating women on what's available to them. So please know this as I go through this today. Please know that I'm just here to educate. In my book, I wrote it 50 times. I call it Genma. In the Marine Corps, we love these little ditties that we use, right? It helps us remember stuff because we only have partially functioning frontal lobes. Is that really, everybody thinks Marines ate crayons. So has anybody ever heard that Marine eat crayons?
So we love it.
Well, they're cute because they're not being said to you. Come on, girl, busting up my emotional well-being. So again, I just want to please get that out there just so you guys know that. Okay, so for purposes of what I'm going to talk about here, what I like to do is kind of give you an idea. Number one, show of hands, you're not going to hurt my feelings, I promise you. Show of hands, be honest. When I say the word or words, hormone replacement therapies, how many of you think something negatively? Yes. Yes. How many of you, just raise your hands, have heard that hormone replacement therapies cause breast cancer? Yeah. Can I please debunk that real quick? This is a very significant portion of what I put in my book, and this is the number one thing that gets me the most phosphorylated. Anytime I or anyone else who specializes in hormone imbalances try to speak out about benefits to hormone replacement therapies, it almost instantaneously gets drowned out by breast cancer. Let me please explain where that originated from. There was a very large study done back in 2002. It's called the Women's Health Initiative. To date, the largest randomized clinical trial specifically for women's health. It was a $675 million study that was conducted by the National Institute of Health. This study was designed to prove the hypothesis of women taking hormone replacement therapies are there long-term benefits for women taking hormones. Back in the 80s and 90s, it was very, very, very common practice. If you were a woman entering menopause, didn't matter, symptomatic, asymptomatic, healthy, not healthy. If you were a woman in 1980s and 1990s going into menopause, you were prescribed hormone replacement therapies. They thought there might be a problem with that, so they conducted the study, Women's Health Initiative. 2002, they shut the study down 2.5 years early. They call on every single camera from every single show in the United States. And there's a group of people sitting in front of the camera that said, if you're a woman taking hormone replacement therapies, you increase your risk of breast cancer by 25%. Overnight, hormone replacement therapy prescriptions dropped off by 80%. Every single GYN, every single PCP was calling every single one of their patients saying, stop taking hormone replacement therapies. Here's what they failed to mention. In the study, there were women with uterus, there were women without uterus. There were 27,000 women in the study. Women with uterus, there was a placebo group given sugar pills, and there was a group taking what's called conjugated equine estrogen and medroxyprogesterone acetate. These are synthetic versions of hormones. Has anyone in here heard the term Premarin before? Premarin, right? That's synthetic estrogen. Does anybody know what Premarin stands for? And this is not a joke. I'm not joking when I say this. Anybody know what Premarin stands for? Pregnant mare urine. Synthetic estrogen comes from the pee of pregnant horses. Problem number one with the study. Pee from horses is bad. Number one, they were given synthetic hormones. You take the group that was in placebo that was given sugar, 4 women per 1,000 developed breast cancer. Take the group of women that were taking what's called CEE and MPA, estrogen and progesterone, 5 women developed breast cancer. So from 4 to 5 is a 25% relative increased risk in breast cancer. That's the fact. That's a relative risk increase. The absolute risk, 1 additional woman per 1,000 developed breast cancer. There was a 0.1% increased risk in breast cancer. Now, had you known there was a 0.1% increased risk in breast cancer as opposed to there being a 25% increased risk in breast cancer, would that change your thoughts on HRT? Why did nobody ever say that? Why does every single woman not know that? Why does every GYN not relay that information to their female patients? Pharma. Call it what you will. How about the group, Eric, that was only taking estrogen? So a woman who has an intact uterus, you can increase your risk of what's called endometrial hyperplasia. You will never take estrogen without offsetting it with progesterone. Well, if you've had a hysterectomy and you no longer have a uterus, you have a 0% risk of uterine cancer. You don't have a uterus. Love how those stats work out. I'm pretty good with numbers, but 0.0 is pretty strong to me. The women that did not have a uterus that took estrogen alone, there was a 25% decreased risk in breast cancer. Why didn't anybody talk about that? Let's talk about the arm where there was an increased risk in breast cancer. Number one, average age, median age in the study was 62 years old. Pretty far outside when we normally recommend starting hormone replacement therapies. Not saying you're excluded from starting if you're over that age, just saying if you're less than that, normally, and the general rule of thumb is the major organizations, the American College of Obstetricians and Gynecologists, the American Society of Clinical Endocrinology, the Endocrine Society, the North American Menopause Society, all says 60 years old or younger, less than 10 years postmenopausal, hormone replacement therapy should be considered as a frontline defense, a frontline option. Not saying everyone, just because you're under, it doesn't mean you automatically qualify. And please, if I haven't already mentioned this, I'll say it now. Please don't take anything I'm saying right now as medical advice. That is not what I'm here. I'm not qualified to do that. Please don't go back and tell your doctors that Eric said I should start on conjugated equine estrogen and you want pee from pregnant horses. Please don't say that to your doctors. can't tell you how many times I get that phone call. Doctor, I'll be like, you told, I didn't say anything like that. This is just education. 62 years old, median age, problem number one for women that were in the study. Problem number two, about 30% of the women in the study had underlying comorbidities. Obesity, hypertension, type 2 diabetes, hypercholesteremia. These are flaws with the studies, guys. These are problems with the study. The problem is when I come out and say, well, guess what? There's a 0.1% increased risk in breast cancer, but guess where there was a significant improvement? Cardiovascular disease. Number one leading cause of death. Men, women, does not matter. Number one leading cause of death, cardiovascular disease, specifically ASCVD, atherosclerotic cardiovascular disease. As a woman, you are 8 to 10 times more likely to die of cardiovascular disease than you are breast cancer. I'm not going to take anything away from breast cancer. It's disgustingly horrible. I hate it with every ounce of my being. I can guarantee every single woman in here has been impacted in one way or another about breast cancer. You personally, your family, whatever it is. I'm not taking anything away from it, but let's be realistic. As a woman, if you get breast cancer, there's an 85% chance you will beat breast cancer. And I'm not taking anything away from how horrible it is. It's disgusting. If you really want to extend lives of women, if you really want to prevent them from dying an early death, you hit heart disease head on. I'm all about pink ribbons supporting breast cancer. I'm all for that. We need red ribbons. I'll give you a trick question. Remember, this is a trick question. Do not get upset when I give you the answer. What about the parrot, by the way? Didn't you say something about the parrot earlier? The parrot? Yeah, Eric the parrot.
Yeah.
Okay, good. Patient presents with their first major cardiac event. In the world of medicine, it's called a major adverse cardiac event. MACE, you might have heard of that. Man, woman, doesn't matter. First major cardiac event. What is the number one symptom they present with? Remember, trick question. I love when nobody gets the answer. This is great. You ready for this? Sudden death. 49% of people who suffer their first major cardiac event die. Why do I give you that stat? I give you that stat because about 90% of cardiovascular risk is due to modifiable, preventable lifestyle issues. Number one, don't smoke. Number two, manage blood pressure. Number three, monitor lipids, cholesterols. You do those three things, you decrease your odds of dying by cardiovascular disease by about 90%. Guess what the number one most protective hormone is for your heart? Estrogen. Guess what a woman loses when you go through menopause? Another fun fact. Me as a guy, I make more estrogen than a postmenopausal woman. Why is it 2/3 of Alzheimer's patients are women? Thought process there is, they call it your reproductive life cycle. So from the date of your first period to the date of your last period. That's referred to as endogenous estrogen exposure. The longer that time frame is, the longer you've had your period, the more consistently you've had that estrogen exposure, the more protection you have against cardiovascular disease. As a woman, you have a 10-year protection over men for cardiovascular risk. Meaning, if you're 40 as a woman, you have the heart of a 30-year-old man. If you're 50 as a woman, you have the heart of a 40-year-old man. Well, guess what happens at the age of 60 for women? You now become more susceptible to cardiovascular disease than men do. What's the thought process there? Thought process is 51's the average age for menopause. You lose estrogen. 9 years of no estrogen exposure means you have more risk for dying from heart disease. Osteopenia, osteoporosis, bone disease. That is the most under-respected disease there is. Nobody wants to talk about osteoporosis. That's an old person disease. That's what I hear. I'm already bringing you guys down enough right now. Don't want to give you the stats on osteoporosis. You don't want to know the stats, right? You don't want to know the stats. They're not very good if you're over the age of 60 and you have a hip fracture and you have to go in for surgery. They're not very good. I talk about Alzheimer's patients being women. Of the 2/3, they carry a gene called an ApoE4 gene. You might have heard of white matter hyperintensity volume. These are lesions on your brain. There's now studies that show that estrogen can provide protection against that. So all this being said, if you have a therapy that can help mitigate menopausal symptoms almost immediately. I can't tell you how many women sit in front of me, and this is where I became obsessed. This sounds silly when I say it, and it sounds bad, but it sounds weird the way I say it. I love menopause. I know it sounds really stupid, right? Because you're like, Eric, now I really hate your guts. That's okay. So bad. Stacy, where's Stacy? You guys are never coming back again. Sorry, Stacy, wherever you are. I can't tell you how many women, and this is where I became obsessed with it, because I loved the emotional intelligence and mental toughness and helping salespeople get better and helping them strengthen relationships and how to remain in control of your emotions and how to separate logic from emotion and how to do all these things. I love doing that. It was very satisfying. But for me personally, there is no better feeling, and again, this sounds bad to say, but there's no better feeling than having a woman sit down in front of me and view me as the absolute last-ditch effort she has to getting her life back. Legit gives me chills. I'm obsessed with it. Because by the time they sit down in front of me, their husbands already think they're cheating on them. No sex drive. It physically hurts to have sex because there's vaginal dryness, vaginal atrophy. No sex drive. They're not sleeping. They're up all night with hot flashes and night sweats. They can't think correctly. They're taking care of their kids. They're taking care of their parents. They're taking care of their husband's parents. They're going to their doctors that tell them to just stop eating chocolate chip cookies and take anxiety medication. So when they sit in front of me, it's just, Eric, I'm done. You are legitimately my last-ditch effort. If you can't help me, I don't have any idea what I'm going to do. I honestly don't know that. I am obsessed with that person. Because I can tell you what, I've seen it time and time and time again. That same exact woman who has that same exact emotional, I refer to them as emotional tornadoes, same exact woman 60 days later is pulling me up in my office, closing the door, crying again, but this time because I saved her marriage. These are the things that boggle my brain. If we have stuff available, if we have research available that can provide and show statistically, it's proven. This is the other thing that frustrates me, the Women's Health Initiative. I'm continuing now to hear things about, oh, there's new science out about hormone replacement therapies. I'm like, what's the new science? They're like, it's the Women's Health Initiative. I'm like, it's 20 years old. It's not new. What's new is the lens you're viewing the information from. Maybe it takes someone like me with only partially functioning brain activity to look at it. So for me personally, I feel like the benefit I can provide to women is to view data and view it very objectively as far as what I'm looking at. I have no medical training to skew my thought process. All I have is brain activity that tells me, well, this doesn't make any sense. If I have A, B, C, and D, why wouldn't everybody be taught? Like, I don't grasp this. I don't understand that. My book was designed for exactly that, and I have to tell you, if I'm being totally honest, I have gotten quite a bit of people who have been upset with me because of my book. I sincerely hope nobody in here feels that way. I sincerely hope that you do recognize there just needs to be more awareness on this topic. We're seeing a ton more now in the news. Good Morning America, Today Show, they're putting all this information out now about what women should be understanding about hormones. There's not a whole bunch of new science, guys. It's been there for a very long time. But if you're not educated on it, what's going to happen when you start to go through this? I put a chapter in there for the husbands. Right? That's the other thing I heard so much about when I wrote the book. They're like, Eric, you really need to write a book for guys, for husbands. Or not even husbands. Brothers, sons, anyone who has women in their lives. And I put a chapter in my book. It's a short chapter. All my chapters are short. They're very large margins. Very big space, very big font. It is, seriously. It's like, it's very good. Yeah, it's losing fishing, exactly. I don't remember what I was talking about. What was I talking about? The male section, I'm sorry, yes. I just turned 50, guys, excuse me. For guys, I put one simple chapter. I get calls from the guys all the time. So when the wives will sit down in front of me, they're, again, emotionally distraught, whatever. They'll talk about their husbands. I say, do me a favor. If you would like, I would talk to your husband. Obviously, HIPAA comes into play. You guys know privacy. I don't play around with that. I don't joke around with that. If I talk with the patient, if I have a conversation with you, I don't care who calls me. I'll pretend like I don't even know who they are. I do not have discussions with anyone else other than the person I'm talking to unless they want me to, give me permission to, whatever. But I'll tell the wives all the time, be like, do me a favor, have your husband call me. If you're comfortable, have him call me. And I have almost the same conversation every single time. They'll call in, be like, hey, Zarek, yeah, Zarek, yeah, you're working with my wife with hormones. I'm like, yeah, I am. Yeah, she's great, whatever. So help me understand, because I had a pretty in-depth conversation with your wife, and I did talk with her. She said, it's okay, we're talking, because I want to make sure they know too. She's struggling a little bit, and I said, I just want to kind of feel where you're coming from as her husband, because I know she said, you guys are, it's been a little tough, whatever. And I'll ask the same exact question every time. I'll say, do me a favor, on a scale of 1 to 10, help me understand how frustrated you are. As her husband, help me understand. 1, you're not frustrated at all. 10, you're very frustrated with your wife. Doesn't matter why you're frustrated, just frustration level. Almost every single time, the guys will be like, I'm at a 10. I'm like, okay, that's fair. If I could just explain one thing to you, you're at a 10 on that scale. Your wife right now, 157 on that scale. So do me a favor, do yourself a favor. What your wife needs right now is support, because she's getting none from anybody. Every single person in her life she's looking to is all telling her the same exact thing. Suck it up and deal with it. This is what women do, right? You're down here on the priority list. I joke about this, but I'm being serious. Your husband's first, then your kids, then the neighbor, then the FedEx guy, then there's the mailman. The person at the grocery store, of course, the produce person's wonderful. They come first. The stranger you just met. Then all the way down here, it's like, oh, yeah, me. Oh, yeah, me. Why? I talked about this offline too. I cannot stand when guys come to me talking about menopause. Dude, get the hell out of my face. I can't stand that. Menopause. You get a freaking menopause. So it's all these guys. It's like a joke when I was in the Marine Corps, right? We go through sexual harassment training, okay? Because there were women Marines when I was in the Marine Corps. There were women Marines. We go through sexual harassment training. Okay, as Marines, you got to be cautious what you're saying, how you're doing it. If you're out in the field, because as Marines, we got an IQ of 7, and we don't really say the nicest words all the time. When you're out in the field and the way you talk and what you do, you got to be a little more careful about your surroundings, and you have women around you. You got to be very cautious of this. So we'd always go through the training, and it would always talk about male Marines saying things, doing inappropriate things. And it'd always be that one stupid person. I have a question, sir. What about if a woman does something inappropriate towards a guy? And it's like, dude, shut up. There's never been a woman said, you wish a woman say something inappropriate to you. Just shut up. So when this menopause stuff comes, I'm like, please shut your mouth. Because all you're doing is diverting attention away from somewhere it doesn't need to go. As a guy, let's be realistic. I like helping guys too. I do. I'm obsessed with women's health. If you give me guys and ladies, I will go with the ladies every single time. But let's be realistic. As a guy, our testosterone level gradually drops. So we just wake up one day and we're like, you know what? Wow, I did put on some extra body fat, did lose some muscle mass. I do have a kind of a lack of energy. Maybe my sex drive is bad. They'll come in. We'll pull their blood. Yep, you're a candidate for hormone replacement therapies. We'll give them testosterone, intramuscular injections, 0.8 cc's of testosterone cypionate once a week, intramuscularly. 3-4 weeks later, 2-3 months later, I'll see them like, hey, dude, how's everything? Everything cool? They're like, who are you? Like, do I know you? I'm like, yeah, I helped you with testosterone. Like, remember, I talked to you. Like, oh, yeah, good, have a nice day. Women come in, game change. Like, it's just the level of the significance, the impact that we have on people's lives is just in a totally different stratosphere. So to have these guys talking about, ooh, menopause, ooh, I'm going through testosterone stuff, it's just dangerous, it's stupid, it's ridiculous, and it makes me very angry. Another fun fact, you ladies probably don't know this. Testosterone's for men, right? Estrogen for women. You might be surprised to know. Testosterone is actually a woman's dominant hormone. A woman makes more testosterone than they do estrogen. A fraction of what a guy makes, about 1/20 of what a guy makes. But when you pull your blood, you see testosterone here, you see estrogen there. The problem with it is they measure them in different units. Testosterone's measured in what's called nanograms per deciliter, estrogen's in picograms per milliliter. They're different units of measurement. If you break them down into comparable units, your dominant hormone is testosterone. Well, guess what? There's no FDA indication for women in testosterone replacement therapies. So when you go to your GYNs, they'll tell you don't need testosterone. Never mind the sex drive that you don't have that's ruining your marriage. These are all things, guys, that everybody needs to understand. Please know anything you see, anything that I'm going to talk about, anything you see me moving forward, please know at the core of what I'm doing is trying to get information into the hands of the people that need it. Your friends, your family, your neighbors. I'm trying to do as many of these types of events as I possibly can. And I'm trying to make my transition in TV world into menopause. Okay, I've done 1,000 TV shows in the last 5 years promoting my first book. So I'm known in TV world as the mental toughness guy. Right? I've been on every show across the United States. Again, legitimately 1,000 of them. So I'm mental toughness guy. Something happens, they'll reach out, Eric, what are your thoughts on this mental toughness wise? I give them my thoughts. You want to go live on air tonight? Go live on air tonight. Did that for 5 years. Well, now I'm reaching out to the producers, the people that I became friends with. A lot of these ladies I became friends with, I've been on their show multiple times. And I'll be like, hey, Ellen, yeah, it's Eric. Yeah, look, hey, I'm getting ready to send you a pitch. I'd love to come on air. And like, great, absolutely. Yeah, send it over, we'll put you on air. They're like, so I'll hang up the phone, I'll send them the email on menopause. And they'll call back and be like, Eric, you sent the wrong pitch. I'm like, I didn't send the wrong pitch. They're like, no, we got something about menopause. I'm like, yeah, that's my pitch. They're like, mental toughness, critical thinking, objective reality, systematic desensitization, graduate exposure therapy. Now you're talking about menopause. And I respect where they're coming from, but they're asking me very honestly, Eric, with all due respect, we're getting ready to put you on live television. What are your credentials? What do you have that we can put you on air for this? I'm like, well, if you're looking for letters after my name, I don't have them. If you're looking for someone who was willing to jump in front of a Mack truck for a topic that I feel like I'm fairly educated on, then I'm your guy. And I've had a very difficult time breaking into that market. I've had a very difficult time, and I respect that. I did Fox 45 a couple weeks ago. They're very good friends of mine. I've done that show many times. They allowed me to come on, which is wonderful. I just got booked for Great Day Tampa. I'm actually flying down there May 5th. I'm doing their morning show. I'm out here advocating, fighting. There were a couple ladies. I don't think that person's in this room right now, but there was a lady earlier who got pretty upset with me because I said I was advocating for women. When I say that, I'm not saying it in a way that I feel like you're incapable or you're not able to on your own. But what I found to be pretty powerful for me as a guy who really has no skin in this game, right? And I know I never had my period. I will not claim to understand what it's like to have vasomotor symptoms. All I can tell you is I've seen firsthand women who are going through hot flashes, night sweats. About 85% of perimenopausal women will exhibit those. 43 years old is average age, by the way, guys. Average age for perimenopause to start. Those symptoms can last 7 to 10 years. 51's average age for menopause, medically defined as 12 consecutive months of no menstrual cycle. This is retrospectively diagnosed. When you go through these things, they can significantly alter your life. Me as a guy, without the medical training, I'm hoping that's going to be my niche, kind of along the lines of almost these producers are going to feel sorry for me and just put me on air. Like, dude, you've been blowing us up. Like, we got to put you on air. I'm going to add a little bit of a little twang to it, a little bit of goofiness about it, goofy stuff, whatever you want to talk about. When I use the term advocate, and I hope that didn't upset anybody else in the room, when I used the term advocate earlier this morning, I probably should have replaced that with fight for, whatever you want to call it. There needs to be male voices talking about this topic. There needs to be men that are discussing things that nobody discusses. There need to be people who understand the significance of giving women access to information that they need to thrive, not just survive. That frustrates me to no end. To just do what moms do, to do what women do, is just push through, push through, push through. I'm okay, I'm fine, I'm okay, I'm fine. Well, there's a time where we should start addressing issues that need to be addressed, and this is the major one. There is no larger gap in the healthcare system than the misinformation, the lack of education on this topic. As a woman, go online right now. You will find significant information on how not to get pregnant. You will find significant information on how to get pregnant. You'll find this much information on how to nurse your child after they're born, which is kind of important. I didn't know how to be fed. Nobody told me that. What you won't find is information on something that every single living, breathing woman will go through, which is menopause. Whether it's naturally due to age, chemically due to treatment, or surgically due to hysterectomies. You want to talk about another area that fires me up? Are women who have had hysterectomies, They're called bilateral oophorectomies, where you also remove both ovaries. You go into instantaneous overnight menopause. For those women to not be educated on hormone replacement therapies is ridiculously dangerous. You take a woman in her 30s, even her early 40s, who loses total ovarian function and loses estrogen overnight, her risk of dying an early death due to cardiovascular disease and or neurodegenerative or osteoporosis skyrockets. So the fact that they're not educated on it is belligerent. And again, I'm not saying every woman should do hormone replacement therapies. Please don't take what I'm saying. There are categories of women who are not candidates. There are categories of women who should not do it. 100%, please don't take everything I'm saying as you should do it, you should do it, you should do it. What I am saying emphatically, 100% of women and people that are close in their lives, 100% of those people must understand hormone replacement therapies. Whether or not you decide to do them, that's your decision. In the Marine Corps, we say junk in, junk out. Meaning, if we're in a battle situation, if we put bad information in, we're going to make bad decisions. If you don't have the facts on hormone replacement therapies, how can you make wise, beneficial, long-term health decisions that will affect you immediately and all of your family? If this voice gets loud, guys, which it's going to, even if I play this much of a role into it, if these voices get loud enough, there will be attention brought to it. And again, for me, not being a medical person, it legitimately is the easiest fix ever. It is so ridiculously easy to fix. The level of discomfort, the level of life that they're just not living, and the thought of 60 days later, and it's almost every single, I'm not going to say every woman's going to take hormone replacement therapies and be like, oh yes, great, wonderful, I'm awesome. I will say the vast majority will. Weight loss medications, didn't talk about that. I did put a chapter in my book relating to that because I felt like it was very relevant. You've all heard about the Ozempics, the Wegovy's. So many misconceptions on that. Number one, Ozempic is not a weight loss medication. Ozempic is a type 2 diabetes medication. The active ingredient in Ozempic is what's called semaglutide. Semaglutide is a GLP-1, a glucagon-like peptide. They noticed there was a side effect to type 2 diabetics that were taking this medication. There was a weight loss component. Nothing extreme, but enough where it raised some eyebrows. Fast forward 2021, they ran a trial. They fast-tracked approval for what's called Wegovy. Wegovy and Ozempic have the same exact active ingredient, which is GLP, which is semaglutide. The difference between the two is Ozempic has this much semaglutide, Wegovy has this much semaglutide. The weight loss results are significant. There's another medication called Mounjaro. You might have heard of Mounjaro. This is what's called a dual agonist. Watch this. I'm impressed. I'm ready. It's a glucose-dependent insulinotropic polypeptide. Told you. That's even more aggressive, called Mounjaro. That's also to treat type 2 diabetes. It just got FDA approval for what's called Zepbound. These are medications, guys, that are extremely effective, and for the right people, they are magnificent. But you have people walking in wanting to lose 10 pounds and getting ready to go to a trip to Cancun, probably not smart to do. What was that? Exactly. There were some studies done on that. You're absolutely right. Yeah, because birth control can help negate. The other thing I joke about with women when they walk in wanting to talk about, here's the other thing that's dangerous, and I'm getting ready to wrap up here. The other thing that's dangerous about this, women come in thinking they want the weight loss medications. Meanwhile, it's a hormone imbalance. So I'm like, why don't we do this? Why don't we pull your blood? Because before we prescribe anything, we do full blood panels. Do a full blood panel, sit down with the provider. Our medical director is a cardiologist. We have 10 nurse practitioners, 2 physician assistants, another MD. Sit down with the provider. Guess what? The weight loss you're looking for might be obtained through just balancing out your hormones. The weight redistributes right to this region. Because I can tell you this about the weight loss medications, the GLPs and the GIPs. I can tell you this right now. I joke with women. They'll come in. I'll turn around. I'll point to their butt. I'm like, do you like that? You like your butt? They're like, yeah, they're like, I like my butt. I said, it's going to go. Just so you know, it's going to be gone. And like, what are you talking about? I'm like, your butt will go. It will go. It will go. I mean, I can tell you right now, this is the problem with the medications. All we do, not we, all the medical community does is they look at the total weight that was lost without looking at where did the weight loss come from. We have a machine called an in-body machine. It's bioelectrical impedance analysis, low-level electrical current that you send through your body. You stand on the paddles, you hold your handles out like this. It tells you the difference between lean muscle mass and body fat. If I have a 200-pound patient who loses 20 pounds, they lost 10% of their body weight. That sounds great, Eric. That's magnificent. That's good. What if I told you that 18 pounds of that was lean muscle mass? Not good. Because guess what happens? They lose the weight, it's lean muscle mass, now they come off the medication, they're skinny fat. Try putting back on lean muscle mass. That's not easy to do. Megan will attest to that. She's a trainer. She'll tell you about that. You don't want to lose lean muscle mass. Every single study, anything linked to longevity, everything will go back to retention of lean muscle mass. One of the most, it's magnificent for glucose disposal. It's great for protecting against falls. It's good for balance. It's great for minimizing cardiovascular disease. There's so many benefits to it. Last stat I'll give you, then I'm going to stop because I do give you guys a couple minutes for questions. You can hold it up. What number am I at now? How many is 5? 1, 2. It's a 5, 5. I was just going to say something about a stat or study. What was I talking about? Lean muscle mass. I need a bigger hint. Longevity, I don't remember. Oh, did you guys know this is what it was? The stand to sit test. Have you guys seen that? So it's basically a test that you can check to dictate or to give you your odds of cardiovascular disease. And basically what happens is you stand up, cross your legs, you sit down on the ground. The more difficulty you have standing up without using your hands will determine your level of risk for cardiovascular disease. Is you dead? Sorry, guys. Let's go. So the reason behind it, the thought process is there's multiple things. Number one, most importantly, it's called visceral adipose tissue. Visceral fat's fat that surrounds organs. So the pinchable stuff on the exterior is called subcutaneous fat. It's great. We have to have it. It's part of our evolutionary advantage. If we couldn't store energy, we'd die. Although we have Taco Bell now, so we'd probably be okay with that. The stuff underneath is called visceral fat. It surrounds organs. It suffocates organs. And it's extremely dangerous. You'll see guys a lot of times with that rock-hard belly. That's someone who has high visceral fat. Their risk of cardiovascular disease is significant. That test will detect it. And again, it's a sit-to-stand test. It's not fail-proof, obviously. Guys, I'm going to finish up with that. We got a couple minutes left. If there's any questions, a couple things I did want to comment on. Number one, my book, The Menopausal Marine. I do have some additional copies out there if any of you ladies would like to read it. Would I ask you, if you could please, when you do read it, number one, love feedback. Number two, if you can give me a review on Amazon. I'm trying to get reviews on there. Number three, I ask you to please share it. I would love for this to just go out. If somebody wants to come in their office, I'll give you copies of it. It's also on Amazon. My kids are starving. I need to feed. That's on Amazon. Sure. They don't need to eat, right? Remember, I forgot I had to feed them. Crayons, exactly. It's also my website, menopausalmarine.com. I'm on social media. I'm on Instagram. I'm on Facebook. It's just under Eric Rittmeyer. Please follow me on there. Trying to get my following up. I'm getting ready to start a TikTok. Don't laugh at me. I don't want to start a TikTok. I have to because I'm trying to get national TV exposure, and I'm recognizing the only way I'm going to do that is by doing something stupid and silly on TikTok. I hate TikTok. I'm sorry. I do not like it. Although I will say that there's some very talented people on TikTok. That being said, I don't want to be one of the ones that look like a big old head on there talking about goofy, silly stuff. Last thing, my video guy, Tiger's over here. If you guys, he's going to be out there. He would like mic you up. If anybody, if you're willing, if you would, it would help me. 3 seconds, 5 seconds, 7 seconds, just a quick camera clip. Sat through Eric's program, great, awesome, whatever. I'm just trying to get, again, I'm trying to build this library of information that's going to kind of allow me, I hate to use this term, it sounds so bad, but it's kind of like I want to kind of go into the back door with this. Like I kind of want to just get to the point where I end up on Good Morning America and they're like, who the hell's this guy? What's your training, you know? That's kind of how I want to get there, just by all these other things. So I would ask you, he'll be up front there, Tiger, whenever you want to head out. He'll be up there with the microphones and all that. If you guys wouldn't mind, it'd be very, very helpful. Last thing, I'll open up one. I know there was a hand up there. If you had a question real quick, or were you going to say something, please? Please, I'm ready. You're very welcome. Thank you. Thank you. Yeah. So two-part question. Number one, as it relates to healthcare providers, medical people, medical professionals, anyone who's insanely smart, which I'm not, I have the absolute utmost respect for them, and nothing, I say this in the book specifically, any information I'm giving is not meant to jab at GYNs, to jab at PCPs. These are amazing individuals who devote their whole lives to saving life, to extending life. So by all means, none of this I'm saying in a negative way towards them. My thought to them is we have to do a much better job at educating them in school. I've interviewed tons of doctors, and I've asked them, and I can tell you this right now, the average doctor in medical school, as far as hormones are concerned, 3 hours of training is what they get. 3 hours. Extremely dangerous. As far as you all talking about it, the great thing about women is, as guys, normally, generally speaking, making a blanket statement, as guys, when we're put in these situations, high stress situations, adversity, we tend to rely on a process I call avoidance coping, meaning we don't like to deal with it. We avoid it. Drugs, alcohol, gambling, whatever. We don't like to mess with it. This is avoidance coping. Again, I'm making a blanket statement, not saying every guy. I'm pretty in touch with my emotions. I'm pretty good with that. Women, when you guys get put in situations, normally I refer to this as tend and befriend. Meaning, generally speaking, women will tend to the issue and they will befriend other people. So the way I see this whole tide shifting is by everyone collectively talking about it, bringing it up, calling somebody out when they say something about it, having these discussions, going on social media, whatever it is, getting it out there. Because if nobody says it, if it doesn't go into existence, it continues to remain silent. So it's just collectively, I think, having these kinds of conversations in these types of settings, which is why I love being a part of these exact types of events. Please.
You have to sit on this aisle to be named, Robin. My question is this. I started doing some research just as you were chatting about the hormone replacement therapy clinical trials. And all those findings that you mentioned are at the top about the misinformation. And only at the very, very bottom of Wikipedia is, oh, and some of these studies were found not to be true or whatever. So is there any thing we can do besides just chatting with each other about getting this information updated in forums like Wikipedia and the other trials that you mentioned aren't happening?
So number one, a bit of advice, anytime you're reviewing any type of study, irrespective of the topic that you're researching, it doesn't matter what it is. The very first bit of advice I would give you, number one, what type, don't do it. That's good, don't do it, or don't do it. Number one, critically important, what type of study was it? I can tell you right now, if it was an observational study, move on. Observational studies are wonderful for helping to find consistencies, to helping to find something, but what they're really good for, and the main purpose of them, is to see if there might be some sort of hypothesis that we want to test. The only way, once we have observational studies that all show us, because correlation doesn't equal causation, right? So if we have tons of observational, this is called a meta-analysis, if we have tons of observational studies that all point to, you know what, hormone replacement therapies might be really good for cardiovascular health. So we have enough of the observational studies. That's now the hypothesis. Now we do a randomized clinical trial, double-blind placebo. So we have placebo that doesn't know. That's the only way to remove all type of bias from the study. So the number one bit of advice, if it's observational, move on. If it's a randomized clinical trial, that's the absolute best, most accurate study. The problem is the last one was almost $1 billion, the Women's Health Initiative, and it's not that the study was flawed. The setup kind of was, but the information was incorrectly extrapolated from it. Anybody else? And I'm about to finish up. I'm going to be here for a bit too, guys. We are doing B12s out there. Oh, I should mention that real quick. Ashley, she's somewhere around here, my nurse. She's doing B12s. I'm cutting her out of here after this, so if you guys want to go out there, not like immediately as soon as the door's open, but if you guys want B12 shots, inside your bags you all got IV cards, free IV cards. My information's there. I welcome every one of you. My cell phone's on there. I legit answer my cell phone all hours of the night. Like, I don't care when you text me. I don't care when you call me. I'll be available. Thank you guys all so much. Tiger's going to be out there if you can see him too. If you don't mind, give me a couple second, whatever, would be magnificent. If you're camera shy, that's okay. Those of you that took syringes in your arms, don't tell me you're afraid of a camera. Thank you all very much.